What's going on, everyone? Welcome to the Healthcare Hustle Podcast. Today, we are joined by Danita Smith, founder and CEO of My Blooming Health, a mobile lab offering in-home and walk-in lab services for individuals with limited physical ability, those who may be underinsured or without immediate access to healthcare, or just for the convenience. Danita, welcome to the show.
Thank you for having me. Thank you, everyone.
We're so excited that you were able to join us today, and I think our listeners are going to be really excited to hear more about you today. So we're going to kick off the way that we always do. Danita, could you talk to us a little bit about your story?
My story. Well, my story is all under healthcare. It's all under healthcare. I started back in high school. We had a high school program where I was able to become a CNA while in high school. So at the age of 16, and then by the time I turned 17, I was an LPN. So truly healthcare, nursing, that's pretty much what I know. That's my background. From there, I went on to community college. So I strongly encourage community college. It's not like an out of the box, not typical type of education. If that's where you go, if that's what you can afford, I highly recommend a community college. So that's what I did. I got my RN associate's degree, went on to get my bachelor's in nursing at a 4-year college, McKendree. It was McKendree College back then. Now it's McKendree University. And then later I got my MBA through Webster here in St. Louis, Missouri. So pretty much grew up in BJC. That's my healthcare background. I worked a couple of nursing homes prior to that as a CNA and an LPN, but as an RN, I primarily worked cardiac, pulmonary, and then went into case management and then managed the hospitalist program with the physicians at one of the BJC health centers.
Go ahead, Nigel.
I was going to say, I think that's a pretty awesome start. I've heard of trade school programs where people can go to work on cars and things like that in high school, but I haven't heard of an LPN program like that in a high school situation. I'd love to hear what drew you to doing healthcare at such a young age. That's such an early time to make a commitment like that. And then I'd love to hear a little bit more about the program itself. Is that just something offered at your school, and have you seen that other places?
Okay, now mind you, I've been out of high school a long time, a very long time. And there was actually just one more class after my class because obviously the high school students kept dropping out. Like we started off with 24 and ended up with 4 that we graduated with.
Oh, wow.
I mean, we were young and I almost dropped out just because, you want to enjoy your teens. And usually at that age, you cannot see the future. You can't see, what your life track will look like. And so you kind of make an instant decision. But I had a couple of nurses who I did clinicals with that helped me make the decision to stay on track, which I did. But I was pretty young. I think I was about 8 or 9. And there was a girl at church who was a nurse. I'm sorry, you guys, I can't get that to mute. But there was a girl at church who was a nurse, and she stood up a couple of times to testify and talk about her stories with her patients. And almost immediately I was like, that's what I want to do. I want to be a nurse. So I was pretty young. I was still in my single digits when I knew I wanted to help people feel better when they're sick. And so that's been my mindset, and that's what I've been doing.
Wow, that is absolutely amazing. A lot of thoughts really do come to my head in terms of just your career as a nurse, because it sounds like you really bossed up and really achieved some awesome goals in that field in particular before pivoting into the entrepreneurial space. But I kind of just want to know the mentality, kind of to Nigel's, question, of a 16-year-old who had the stick to itness to really, pursue something, so what kept you, like you said, you mentioned you dropped out, but really what was it that kept you kind of on this pathway?
It was simply, one of the nurses said to me, I did clinicals at Wood River Hospital. I don't even think that hospital still exists, but over in Illinois. And one of the nurses said to me, she said, Danita, do you know that if you drop out now, and I know you're young, but if you drop out now, life will get in the way and you'll never finish. And that just resonated with me. I mean, here I am now, mid 40s, and that still sits with me as if she just said it yesterday, but it's real. we're now all older now, and we understand what it means for life to get in the way. And she was right. So that is what allowed me to stick with it, because I did not want things to happen within my life that was going to throw me off my career path and keep me from being what I wanted to be.
I love that, and that's powerful. Life will definitely get in the way, and I think in both positive ways and sometimes not so positive ways. Just
Right.
life happens.
Just life. Yeah.
Yeah, life happens. I love also that called out community college, right? As something that is a viable option for many people. Can you
Absolutely.
speak to kind of just the uniqueness of that experience and how, like, what are some of the biggest takeaways that you felt you gained from your experience in community college?
Um, well, to be honest, I can't compare it to like the dorm life because I never did the dorm life. All I can say is with the community college, because I love my family, so I was able to stay home, live under mom's roof. I loved it, and I didn't have all the hassles of what I hear about dorm life. The instructors there were very caring and compassionate, and they gave us direction. They're the reasons why I went to McKendree as my next step, is just because they work with you so closely one-on-one. You're not in like a room full of 150 people and you're just this number, and you have to have that your own strength to push forward. They work with you one-on-one, and it's just like a small family. I mean, I adore the various instructors, and of course the other students that were there. We all kind of created a pact and had our study groups, and it was wonderful. Yeah.
Yeah, I think you brought up a really awesome point there. I think, a lot of young people, especially now, there's just so much pressure to know what you want to do and what you need to do at such a early age to be making a decision like that. And the go-to is often just go to college, take out some loans, you'll figure it out along the way. And that shouldn't be the go-to for
Right.
everyone. So I think it's a great message to go to community college. It's not any lesser. It's a great opportunity. You're going to learn awesome things there, and then can become a fantastic entrepreneur like yourself that we have here today.
Mm-hmm.
I'd love to hear a little bit about your transition into your workplaces. So you mentioned that you worked at some homes before you went to the hospital system, and then now you're an entrepreneur. So what were some of the key differences you saw in those different facilities that you worked at as a nurse?
Well, I worked as a CNA and an LPN in the nursing homes, the extended care facilities, and that definitely was key to the compassion that I have for my patients today. I had the opportunity to get close to them. As a CNA, you're the one bathing them. Sorry, you're the one bathing them and feeding them, and ensuring that they did take their medicine and their supplements, and you get to know their family members. So you really get a chance to know who people are outside of your own family and friends. And these old people who are in a nursing home, they once had a prior life just like you and I. They worked, they had kids, they had friends, they went to church, they went to the store, they did everything that we do today. But now they live in a facility where they live, like that's their residence. And so you just learn how to take care of whatever their needs are. And it has allowed me to grow into who I am today as a nurse. And that's just something I can't let go of. So I think even if I was like at some department store running up charges for people, I still would have that same compassion to ensure that people have what they need in order to meet whatever their needs are for that day. Yeah.
That's amazing. It makes me just think about, the experiences that are sometimes necessary to really be an effective or impactful provider. And everyone has different pathways, but for you, for the entry point to kind of be the CNA extended care route, like you said, you're exposed to a much more, or an opportunity, I think, to be much more intimate, obviously, and much more
Right.
one-on-one. And it sounds like you really, took that on. So I would be curious, as you kind of, went on to get more qualifications and, more licenses, and then emerged into a larger healthcare system like BJC, took on leadership roles. What was that experience like? And what was it like kind of going from being right at the bedside, one-to-one patient interaction, to eventually leading entire teams and departments at a major healthcare organization?
Well, um, you have to set goals for yourself. And typically when you set goals, you're going to reach those goals. If you write your goals on paper and you map it out, you will reach those goals. And then you create new goals. And then life just is a big old snowball full of phenomenal goals. So my first time I ever did that was in high school. You know how you get those high school booklets that is full of memories and pictures, and you write who was the class clown and all these different things that you can go back on and look at. And I had my life goals in there as far as where I would be in the next 3 to 5 to 10 years, what car I would drive, if I would be married, kids, what job, that sort of thing. So I wrote all my goals down in that little book and just continued the pathway down the healthcare realm. And so once I kind of get bored easily when it comes to my career. Like I can only learn so much. Once I've learned what I need to learn, I'm going to move on. And that's what happened to me in my first RN position. I worked the cardiac pulmonary unit, and it eventually got to the point where I could literally run my day in my head. I knew what medicines different people would get for what various reasons, and the milligrams, the pushes, the everything. It was so routine that it was boring. Like I need something a little bit more exciting, something that's going to change, where I need a challenge, basically. I need a mental challenge. And so they almost immediately, like I was probably a nurse for less than a year, where I became like the assistant charge nurse or whatever, relief charge nurse, I believe is what it was called. And I enjoyed it because I did get the opportunity to supervise while I was in that role. And of course, when I wasn't, then I was a staff nurse. So it's hard going back and forth. So I was like, well, once I got my bachelor's degree, I was like, well, let me take a step up and into another position. And that's when I left and went to Big Barnes Jewish downtown, and took on the assistant nurse manager position and did that for a few years. And I learned so much as far as leadership. And BJC is a phenomenal health system. If you guys are even familiar, well, you guys do WashU, and I think they kind of job share a lot of things. And they offer almost every single program that you need to better yourself. And it's free. I took advantage. I got to the point where I could not take any other class that they had to offer over there at their BJC Learning Center. I took it all. And luckily I had supervisors and managers who allowed me the time off to go and take those classes during the work week. And so leadership myself out of all those conferences because I took it all. And then my next step was to get a master's degree. And at the time they did not have a master's in nursing program, go figure, but they didn't. So I did master's in business. And that's what led me to where I am today, because I never had an idea that I would be an entrepreneur. Like it never crossed my mind, never considered it, could never see myself in that position. Other people could. They would say things like, oh, I can see you being, I can see you running some healthcare building one day, things of that sort. And I'm like, no, it won't be me. Just because of all the trials and tribulations that you got to put up with as you grow. But with my MBA, with a healthcare emphasis, what led me to what I'm doing. I ended up getting into case management, which I see as the business side of nursing. It's a totally different side of nursing, caring for your patients and what their needs are after they leave a hospital. And you kind of, as the case manager, you kind of fill that black hole that they fall into when they leave the hospital and transition to home. And you wonder why they're back in the emergency room so frequently, because that transition for them is just, it's so, what's the word I'm looking for? I don't know what word I'm looking for, but it's just that it's a vulnerable position for a lot of people, whether they have family members at home or not. It's a very vulnerable position for them. And they typically fall or they fail in that role. And so as a case manager, you kind of help them with that piece. So from there, I went on to be the hospitalist manager, and Dr. Patney, Vikram Patney, he is now renal. He's a renal doctor here in the St. Louis area. But him and I started up the hospitalist program at one of the BJC health facilities. And I learned so much in regards to business, in regards to case management. It was just a phenomenal thing. And that mixed with my MBA with the healthcare emphasis. And we started talking about some of the various needs that our patients needed in order to stay out of the ER so frequently and unnecessarily. you just bring it all together and bam, it's like, okay, I can do that, which was the lab draws, which is what I do now as an entrepreneur. And it was supposed to be a hobby, like an evening and weekend thing. I can just run around and do these blood draws for these people who can't get out of the house and make sure that they get it done. But it just kept growing and growing and growing. And yeah, I'm excited to be able to tell that story, that I didn't expect it to turn into a business, because it was just like something to help out the community with. But here I am with this company that I adore. It's my baby. I've had it for nearly 10 years now. So yeah, really excited.
Amazing journey. And I mean, I think that just keys us up perfectly, actually, for you to talk a little bit more about what My Blooming Health is, what services you guys provide, and kind of just walk us through where you started and where you're at now.
Well, it started simply, like I mentioned, just to do blood draws in the home. And of course, most of the nursing homes is who called me first, which was fine, the assisted living facilities. But I learned, again, another side of healthcare, because I just assumed that all these services was in place for these different facilities, but they're not always. Eventually, it got to the point where individuals started calling me. They had not heard of such a thing. And at that time, it was before I took on insurance. And so I had a couple of people that would call me, but they were like, oh, I have insurance. And so since I have insurance, I don't want to pay out of pocket. So we got on board with the insurance, and we were able to take reimbursement. But there was a little glitch there. And once you sign up to be an insurance provider, you have to just do that. You can't do both. So you can't allow the insurance providers to pay you and you have the patients pay you out of pocket. It's one or the other. And so we have done that for many, many years. We have grown it. We see on average anywhere between 30 to 40 patients per day, and we're Monday through Friday. We have a walk-in lab that we started in late 2019. It's here in Overland, Missouri, 63114. We do drug screens. We do DNA paternity testing. We do the gender testing. I want to next get into the gender reveal party. So I know that is such a big thing. But yes, we do the gender testing. So if you know any pregnant moms out there, send them our way so they can know what gender their child will be. So yeah, we talked about the drug screens. We also do the employee drug screening. So if there are any employers out there, we do have packets set up for the employers to also have their employees come in for testing. And we'll also go on site. So we'll go out to your location, which saves a lot of time and a lot of money for you as an employer, because then your staff member is not leaving work or you have to replace them during those hours, and or you're taking risk of them doing something to the specimen before they get to us. So, where they could pack something that might be inappropriate. And it happens, you hate to admit it, but there wouldn't be drug testing out here if people were not, mistreating things. So, but we're available to help. We do the DOT and the non-DOT testing. So we really enjoy that. And then COVID testing as well. We do the COVID testing here and also mobile. One of the key things that we are about to add, if I can mention that, we're transitioning. You guys caught me in the middle of a huge transition here. So next year will be our 10-year anniversary. And we've had many challenges in regards to working with insurance reimbursement. And so that is going to be one of our major changes that's going to happen. We will turn into private pay, actually here within the next 30 days. So everything will be private pay. So the COVID testing, paternity testing, drug screenings, everything of that sort. However, if you do have insurance, then on the back end, the specimens can still be processed through your insurance. But for us to collect it, it will be private pay. But with that, we're also able to add in IV infusion. So that's brand spanking new. Like we haven't even changed our website yet to update that. But we're adding the multivitamin infusions that we will do here on site here in Overland, as well as in the home. So yes, we're excited to bring on those new services.
That's really exciting stuff. And look at us, Winston. Now we get to be a breaking news podcast
Yeah,
on
you
top of
can.
leadership
All
development.
Absolutely. Yeah, that is so I mean, this is serious, like a super serious endeavor, like just hearing you say everything. And I think there's a lot just from the journey to where you are now, individuals like ourselves, young professionals with some of these ideas, or just how to questions we could learn. One of the things that really caught my ear, was when you first started out and you were working with the different facilities, and you assumed, like I would have assumed, that a lot of these facilities would have had testing services, but they would have had this, covered somehow, some way. Um, and so that just made me think, what are some of the disparities in testing that you see from your perspective, and why is it so important and so critical, particularly for African American or Black communities or other vulnerable populations, to have these kinds of services?
No, that's an excellent route to take. Yes, the disparities is something actually why I wanted to get into this, and why I did switch over to allowing the insurance carriers to come in and help out a little bit so people can know that these services are available. One of the things that we did learn in the hospital when we were doing our various pilot programs is that patients come to the hospital and to the ER unnecessarily several times, multiple times, like within a given 30 days, simply because they do not have the resources. And the reasons they don't have the resources is because of several factors. One being their location, their zip code here in the St. Louis area. And they just do not have access to healthcare as for those that are further out west. Access to healthcare is just not as great as it is out there, that it is in the city. And so I wanted to be that vehicle that they needed in order to bring the healthcare to them, which is why we do enjoy being able to go into the homes. We've got a lot of patients who are homebound, like they're wheelchair bound, they're on a walker, they might have some mental disorder, or they just might be elderly and their adult child is have a family of their own and they work. And so it's a challenge trying to get them out to the clinic to get their blood work done. So when we talk about disparities, you have to consider that the people who truly need this service are those who are not able to take off work. If you take off work, you don't get paid. You might have kids that are too young for you to leave alone, but you also can't, especially during COVID time, you can't take them to the clinic while your mom is getting her blood work done. So it's so much easier and so much more convenient for us to be able to come into your home. So when you talk about disparities, these are the patients who, again, do not have the access to healthcare because they will run to the ER, but it's not until they feel so bad that a leg is about to fall off. And I'm exaggerating, but in that sense, they'll sit there and they'll wait because they don't want to bother their adult child. They don't have the money to get their medicines filled to make sure their lab levels are within reasonable range. And they don't have the money for their copays to see their physician. So if they have somebody who's able to come to them and make it a little bit more convenient for them to get it done and help educate them of the importance of getting your lab work done. There's like 75-80% of the diagnoses are based off your lab results. So if you're skipping your lab results, your healthcare providers don't know how to treat you. And I'm not just talking about just your standard medical doctor, but we have our holistic doctors, our the various genetic testing doctors. There's the chiropractors who do more than just crack your back. I highly recommend, if your insurance will pay for it, or call and see if you can do it out of pocket. The way that these various doctors work nowadays, not just the medical doctors, they are truly here for prevention. And a lot of our people are not familiar with that. We wait until we pass out to know that we have diabetes. Whereas if you're getting your blood work done regularly, you can see these things coming. You can see that your kidney levels might be off a little bit while you're younger. And it's like, if you fix that simply by drinking more water or simply by avoiding certain foods, but you won't know that unless you know what your lab levels are. So when I talk about disparities, we're talking about lack of education. We're talking about lack of finances. We're talking about lack of transportation, and then just lack of people resources, period. You can't always bother your neighbor or your church member to take you to go get your blood work done. So give us a call. We'll come on out. We'll take care of you and make sure that you stay on track with everything.
You shared some really amazing pieces there in regards to disparities and how your lab work affects it. And I thought some of the points that you brought up about holistic medicine practitioners is something that we really don't get to touch on enough, and I think is fantastic information to share out. Something I saw in one of the articles about your organization is that you guys also tie in using a social worker in addition to just doing the blood draw. What inspired you to do that, and what kind of impact have you seen that have on the patients that you guys are seeing?
Well, we actually haven't used the resources of a social work recently. However, we brought the social workers in to assist our patients. Again, when I came in, I worked in North County here in St. Louis. And so a lot of disparities in the North County region. And so I brought the social worker in just to be available for our patients who do talk to us about some of their various concerns. A lot of patients don't even know that they have a concern. You know, they just live their life day to day and they've been doing it this way and it works for them, but it's not working for their health. So when we're having like a casual conversation as to your blood draw appointment, and then you start to tell us about whatever concerns that you have had in regards to seeing your doctor, your other healthcare providers, getting in to get your testing done, x-rays, then if we need to, we have a social worker that's on standby who will just have a casual conversation with you to see what your needs are. And if you do have any particular needs that need to be met, then it will turn into an official consult. And so they can get you all the resources that you need. But social workers are definitely key to helping with the disparities that we do see in the St. Louis region.
Wow. You know, it's so interesting because I feel like one thing that you said, it sounds like your volume is pretty good business, 30 to 40, you know, patients or clients per day. So I can imagine it is a busy day for most of your team. And you know, and I was thinking about, you know, this in-home model, and I definitely want to get your thoughts. I just thought about my father when he was kind of going through his bout with congestive heart failure before he passed away. We had to have a lot of in-home care, a lot of at-home, you know, services, and it was a little bit difficult for my mother to manage because there's a lot of people coming in. Some people were personable, others were just kind of coming in, doing what they're doing and leaving, right? And so it was just a weird experience for us to have. How have you know, can you kind of just expand on the in-home model, how you kind of prepare and set, you know, your staff and your team up? What are the standards? What are the experiences like? You know, what are the learnings like? Or what do you all learn from that? And then how has being in home and dealing with folks kind of at that comfort level, do you feel like that's allowed you to better educate or better have, you know, conversations with folks when it comes to their health?
It's still a challenge, the conversations. And I always say, you know, you definitely need to pray on it. You know, if you have God covering you, you're going to be safe. You're going to be okay. Keep God first, definitely. However, when what we do for our staff training, we definitely talk to them in regards to safety issues. Be very mindful. We all know and hear about stay off your cell phone when you're walking down the street. Even if you're just going from your car up to their front door, people are watching you, and people might think that your bag has something in it that they want, which it doesn't. Our staff carries very minimal. We do not have them collect any money while they're out in the field. We do everything electronically or over the phone from the office. So we try our best to keep our staff as safe as possible, but they also have to individually keep their awareness first. Be aware of your surroundings. In regards to talking to patients to try to educate them, we truly only have a couple of minutes to do so. They can always call into the office and I'll be more than happy just on a nurse level to give them some resources and educate them a little bit. But in the home, we truly only have a few minutes. So we make the appointment. We typically get an order from the doctor's office. They fax it over to us. We upload it into their chart. We'll call the patient to make a convenient appointment with them. Once we're there, we identify them and have them sign our consent form. And then we do their blood draw. We're usually in and out in like 5 or 10 minutes. It doesn't take long at all unless you have really, really, really challenging veins, and it happens. So in those cases, we may be in there 20, 30 minutes, just trying to make sure that we keep the patient as comfortable as possible as we obtain their blood sample. But yeah, we typically have 5 or 10 minutes. And if I'm in the house and I see, just based off of the view that I have from where I am drawing their blood, and if I feel like they have needs, I'll offer. Do you think you need a nurse in here to help you with A, B, and C? Or do you have a family member that can do A, B, and C? And I am connected with a multitude of home care and home health agencies in the area. And we have exchanged patients quite often. So if I see a need that a patient, maybe they have a wound on their leg that they didn't let anybody know about, then I'll have a nurse come in and do an evaluation to see if we can get home health started, that sort of thing. So it's been very rewarding in many aspects to be able to do this and go into the various homes. So,
and a follow-up to that, thank you for that answer, is, and I was reading in one of the articles about, my Blooming Health's experience during COVID-19, and how you all were one of the only healthcare organizations or companies in the region that were actually providing blood services or blood testing services. And I remember reading articles about that and how big of an issue that was for many patients. So can you talk about just what made you make that decision and what that experience was like?
Well, it's so funny because we opened up our walk-in lab in late 2019, and then COVID hit like 6 months later. But with COVID, you just have to respect everybody's wishes. The CDC and the government, they all I still follow a lot of healthcare directives out there. And so we just continue to follow their path, whatever they're doing out there in regards to safety for our patients. And then, of course, the CDC put things out there specific for healthcare workers, what we needed to do. There was actually a local lab that got shut down because they were not following the various PPE guidelines and making sure that their patient was safe, because we're going from house to house to house to house. You don't know who has COVID. Not everybody's going to be honest, if they have symptoms or have tested positive, so that they can still get their treatment. So you have to treat everybody as if they have COVID and make sure you clean down, wipe down, wear your gloves, use your hand sanitizer, that sort of thing. Be very mindful of what you take into the house. It needs to be very minimal, that sort of thing. Things have absolutely gotten lax now that we are about 3 years later here. I mean, we've been dealing with COVID for a long, long time, but we've had some patients who wanted us to draw their blood outside, and that's fine. If it's a safe, secure, and clean area, we're more than happy to, if that's what makes you feel comfortable. Everybody has on their N95 mask, and we have our face shields as well that we used to wear. We don't wear the face shields anymore, but we still wear our mask, of course, and still do the other PPE. But yeah, we had quite a few patients that wanted us to draw their blood outside, and as long as the weather was doable, we respect their wishes. And that's totally okay. If we walk in and you want us to wear shoe coverings in your particular house, or if you want us you want to watch us put hand sanitizer on and clean gloves, we will honor that. I mean, if that's what makes you feel safe, especially during the height of COVID, then that's what we did. It was scary, and we almost shut down, actually. It was so scary. Yeah, I was watching too much of the news. It was very scary. But yeah, we got through it, and I have very tough staff members. They all pulled through. They pulled their weight. They took care of their patients, and it all turned out okay. So we're still standing.
That actually keys me up perfectly. I was about to ask you. So the healthcare side of COVID is something that I think all three of us went through, you in a more direct way than either Winston or I had to do working at WashU and BJC. But another aspect to COVID was the business side of things. And as a small business owner who had just expanded, and then we went into that tough environment, what was that experience like? What was it like with, I'm sure, decreasing volumes at first and trying to help your staff through these tough times? I'd love to hear about some of your leadership lessons and business challenges through the pandemic.
Yeah, you're absolutely right. It was definitely the fear of the unknown, because you didn't know what was going to happen. Our volume dropped just briefly. So we had a lot of physician offices that was obviously closed, which is when telemedicine skyrocketed, and they're doing the video chat with their doctors now more often. So the doctor's visits had decreased dramatically, which means we lost a lot of business in that sense. A lot of the facilities wouldn't let anybody into the facility unless it was imperative. So not even us, because for the most part, we do routine blood draws in the facility. They're not critical or anything of that sort. So we lost that business. But then, and that probably only lasted, I would say maybe 2 to 3 months, but that 2 to 3 months hurts. It was a dent because you didn't anticipate that. But eventually, once people started to feel that COVID was going to be here for a while, we need to figure out how to live, then our numbers shot up the roof. And like I said, we see like 30 to 40 now. We were up to like 80 plus back then. Yeah, it was like, because nobody wanted to go anywhere, and if you can come to us and if you can come to me and draw my blood and I don't have to drive anywhere to anybody and get out and walk past all these other sick people to get my blood drawn, then I'll do it that way. And that's what we got quite often. So we had a very high number for quite some time. And then you can tell once COVID started to ease up to where it is about now, and then it was like just volume started to decrease because people want to get out the house. You got our 80-year-old ladies who now they want to get their hair done. While they're getting their hair done, go get their blood work done. And, they want to go. They want to go. So got to appreciate that.
Wow. It's excellent. And I always appreciate you kind of, giving perspective, giving the patient's perspective or the individual's perspective as well, because it really grounds me in just, how normal testing really should be and how readily available it should be for everyone, One of the things, just kind of tying everything together, that I love this quote, you reference this as well, when you were a nurse, you're experiencing seeing patients kind of going back into the black hole after being discharged from a hospital, and just this reoccurring cycle. I think that's the thing that, obviously is unfortunately standard, in a lot of cities and a lot of different places, a lot of different healthcare organizations. Do you feel like over the course of this 10-year journey almost that you have been able to kind of close that hole a little bit, or maybe potentially prevent from as many people slipping into that pathway?
Absolutely. Yes. That was my number one goal when I left BJC, was to be a part of the person who can help assist with the problem. And that problem was lack of resources to be able to get out and get their blood drawn to where it was even convenient and or understand the importance of it. So that is what we're doing now. And that is what we enjoy. We've met so many new people, so many new faces, and so many new personalities. So we've gone from just doing like homebound individual patients who need routine blood work to people who are younger walker talkers, and they voluntarily get their blood work done because they want to know their health status. They want to live a longer, healthy life. We don't know if we're going to die at the age of 50 or the age of 90 or 100 plus. We've got a 99-year-old patient who lives alone, and they're up moving around, and you don't know what to anticipate. So we've got a lot of young people who are out here and learning and understanding what it takes to have a healthier lifestyle as they start to age. And so, yes, we are excited to be a part of that journey for people.
That's really awesome. Something I would love to know is just kind of, I feel like I look back sometimes and there are lessons I feel like I've learned along the way, or mistakes maybe that I made when I was younger and dumber. Is there anything that you would want to reach back and either tell a younger version of yourself, or even tell someone who maybe wants to open their own thing, but they're just a little nervous about taking that jump? What would you say to that person?
You know what? Steve Harvey said a famous quote. I'm pretty sure you guys are familiar with it. And he says to just jump, right? When you decided you want to do something. I don't agree with that. I do not agree with that, because that's gonna sink you. So you do want to eventually jump, but if you set yourself goals, you have to put a timeline to it. And that's what I did when I was ready to start this. I sat down, I put everything on a piece of paper. I did my research. I went to the state to see exactly what was required, went to the various lab conferences to see what was going to be required. And I put my steps on paper, and I put a date to it because I'm also a procrastinator. So I put dates to it. And just as you're held accountable at work where you get a paycheck, or where your spouse or loved one or your kids expect you to do something by a certain date so that they can have whatever they need, you've got to do that for yourself. So you put dates on there, and when that date starts to get close, you work it up. You work up whatever it is that you need in order to reach your next goal. And then you just start marking it off your list. You just start marking things off your list. And next thing you know, it's like, oh my God, I'm ready to open. Let's put a date to it and have our grand opening, and it's done. Do not jump. I do not agree with that. Do not jump, because you won't have enough money saved up, and you might not, period. But if you have to do your research. If you at least start and do your research, get all that stuff on paper and have a true understanding, you'll be fine. But don't jump without the knowledge.
That makes me feel so much better, because I felt like we should have been jumping with this podcast last year. And we really taken our time.
Yeah, map it out. Now you're going to constantly learn. You're going to constantly learn as you grow. But that initial step, you need to be confident of at least what your foundation is going to look like and feel like. Because once you get that foundation in place, I mean, you don't want to just open it up and then that's what it is. You want it to continue to expand and grow. And you can't do that if you're learning all the basics after you've opened up. So get all the basic stuff out of the way and figure all that stuff out. And then once you're in it, just take off. Just continue to learn. Continue to set goals. Your goals will always lead to new goals. So,
wow, I love that. This is amazing. It's really been an excellent conversation. I know we are coming around, roughly the hour mark. So, just before we kind of get into the last segment of the show, Danita, where can people find out more about My Blooming Health, yourself? Just any contact, website info that you can provide to the audience.
Well, we're excited to bring on our IV infusion program. So definitely follow us on our website, which is mybloominghealth.com. We will shoot out some emails if you guys are already following us. We are on social media as far as Instagram, LinkedIn, Facebook. And I think that's all. I can't keep up with all this social media stuff, but I think those are the ones. But follow us, especially Facebook. I'm pretty active with, and I'll keep you abreast of what our next steps are. You can also call us at 314-942-3273. I gave you our web address, mybloominghealth.com. And yeah, that's us.
Awesome. Well, Winston, unless you have any other questions, I'll go ahead and move us to the last segment of the show. So for this segment, we have a little more fun than we've been having. So I'm going to ask you 3 rapid fire questions. They can be about anything. And you're just going to throw us some answers. So I'm ready to go whenever you are.
I'm ready. Let's rock and roll. See what I can do.
We'll start off easy. Dogs or cats?
Dogs.
Good answer. What was your last impulse buy?
I think they were sunglasses.
I hope they were good sunglasses.
Yeah.
And last one, would you go skydiving or scuba diving?
Nope. Oh, neither one. I want my 2 feet on the ground. I'm good. I won't even get on the roller coaster. I'm good.
Oh man, well, we were going to invite you out for one or the other, but I guess we'll just have to cancel that outing.
Yeah. I'll watch you guys on TV.
Well, thank you so much for joining us today. We really appreciate it. Thank you so much for sharing your story. I learned a lot just listening to you. I'm sure that people will get a lot out of this episode. So thank you so much for taking the time. We really appreciate it. Winston, do you have anything else you want to add on?
No, I just appreciate the time and the opportunity to get onto your show. I appreciate this. So thank you. Yeah, you guys keep doing what you're doing. This is phenomenal.
Thank you so much, Danita.